Welcome to Champions of Care, brought to you by Oakwood Healthcare. I'm Mary Zatina. Today, we're talking about getting a good night's sleep and why you might not be getting a good night's sleep. With me in the studio is Dr. Vijay Khanna, a pulmonologist and sleep medicine specialist from Taylor, Michigan. Welcome to Oakwood Champions of Care.
Thank you.
This is a silly question, Dr. Khanna, but I'm going to start right off by asking you, why do we need sleep in the first place?
We do need sleep because if we don't sleep well, then the next day there can be significant impairment in the memory, judgment, attention span, and lack of concentration.
How many hours a night is the right amount for someone to sleep?
It depends upon the age of the person. The older we get, the less requirement we have for sleep.
Really? But sometimes older people sleep more than younger people.
But they have more frequent awakenings, more frequent arousals, and the quality of sleep is not as good as somebody who's really young.
So in addition to not being functioning as well as we can the next day, are there other problems associated with not getting enough sleep?
Well, they're more irritable, their job performance is affected, they may have some drowsiness when they're driving, they could be at a risk of some accident, or if they're elderly patient, they could be at risk of falls.
Are there lifestyle changes that those of us who don't sleep well can adopt to improve our sleeping?
Well, first of all, we need to diagnose what is the underlying cause for their not sleeping well. Is that just simply insomnia, or there is some kind of obstructive sleep apnea, or there is just simply poor quality of sleep? But if it's simply insomnia, then we need to teach them, educate them about the simple techniques to be able to fall asleep better, like making a habit to go to bed at the same predictable time, also waking up at the same time, and to avoid any kind of late TV show or working with internet or computers, and not to do any kind of exercise just before you sleep, make the room sufficiently dark. So simple things which all of us know can make a big difference.
Dr. Khanna, what about over-the-counter sleep medications and products that are designed to help you sleep?
Over-the-counter sleep medications are not always as predictable. They can have unexpected prolonged drowsiness next day. And some of these medications also have combination with Advil or Tylenol, which are not required to put you to sleep, and they can have undesirable side effects.
And at what point should someone who's having trouble sleeping see a sleep specialist?
First of all, sleep disorders are extremely common and also significantly ignored by the patients. And there is so much which can be done for these patients whenever they have significant fatigue, their job performance is affected, or if the spouse suggests that patient has poor quality of sleep and not breathing at the time of sleep, there are a lot of reasons for patient to see a sleep specialist.
You are a sleep specialist, and you're also a pulmonologist, which means you specialize in issues of the lungs. Is that correct?
That is true.
What's the connection between sleeping well and the lungs?
Well, first of all, the sleep disorders are very common and affect the respiration at night. Patient has a lot of events at night, they're not breathing right, and even their oxygen level can go down, and can affect even the heart and cause some cardiovascular consequences. So there is a lot of correlation between the sleep apnea and the pulmonary medicine.
Is there also a coordination between sleeping disorders, poor sleep, and a person's weight?
Absolutely. If you are not having good quality of sleep, you are not sufficiently refreshed next day, you don't do enough exercise. So the lack of sleep can cause weight gain. Even some hormones can be excessively released, can increase your appetite. So lack of sleep can cause weight gain.
So Dr. Khanna, when should someone call you?
They should call when their sleep disorder is significantly affecting their optimal performance at the place of work, or if they are feeling drowsy when they are driving, or if there is history from the bedside partner, then patient is not breathing right at night.
So the bedside partner pokes him in the ribs and says, hey, call Dr. Khanna, you have a sleep disorder problem. That's a good time to call too.
Absolutely, when that's a very common cause, and when we do a test on a patient like that, usually they have a problem.
Dr. Khanna, I want to thank you so much for being with us today on Champions of Care.
You're very welcome.
Dr. Vijay Khanna is a pulmonologist and sleep disorder specialist with offices in Taylor. You can find out more about him on oakwood.org or call 1-800-543-WELL. Now, I bet you didn't know this, but children have sleep disorders as well. We'll learn more about that coming up in just a minute.